Effects of age on the skeletal system. According to Briticana.com, a bone is a rigid body tissue which is made up of two materials called calcium and collagen. There are different types of bone which all provide different functions. One type of bone is the long bone. This bone acts as a lever for muscles as it has a large surface area. The shaft is called the diaphysis and the ends are called epiphysis. These bones are commonly seen to provide movement, so are represented as bones such as the femur and the humerus. The next bone are short bones, which vary in shape and size and are commonly found in the hands and feet, such as the carpal and the tarsal bones. They are weight-bearing bones. They offer support in everyday life, such as when you are walking, but also in sport when gymnasts are doing a handstand. The next bone is flat bones. These protect the internal organs of the body, so resemble bones such as the ribs and the sternum. Irregular bones also provide protection, and they do not have a common shape, so can be seen as the skull, which protects the brain, and the vertebrae, as these protect the spine. The last type of bone is a sesamoid bone. These are very uncommon in shape and do not have a particular role. However, they are found in the patella, which covers the knee, enabling ligaments and muscles to have a base to attach to. As we age, our skeletal system becomes weaker and more fragile compared to when we were young, and bones were strong and could absorb impact repeatedly. It is common to see older people taking part in sports such as swimming and aqua aerobics. This is because these types of sport are low weight bearing and the water takes the impact of any movements. This allows the older generation to keep mobile but with a smaller risk of becoming injured. One reason we see age affect the skeletal system is due to the decrease of bone density. At a young age, children have a high bone density due to the presence of calcium and other minerals that make up the structure of their bones. When you are young, you are able to take part in lots of physical activity to keep your body fit and healthy. For children and young adults, this means taking part in sports that include impact, such as running, as this could be beneficial because the impact makes bones stronger. However, there is also a risk alongside this because putting too much strain on not fully developed joints and bones could lead to issues in development. When you are younger and taking part in physical activity, it is also expected to see an increase in muscle mass. This in turn puts more strain on the bone, therefore it needs to become stronger so that it can act as a lever for the muscle that it is contracting from. This means that the levels of calcium are higher in younger bones because over time your muscles will be bigger and therefore put a greater force on the bone that they are attached to. Because of this increase in size, your bones must adapt so that they are strong enough for the muscle to perform its contraction. This means that they become denser and therefore thicker and much stronger. Bones are made up of collagen, calcium phosphate and calcium carbonate. The calcium is what supports the structure of the bone, making it strong and hard. Therefore, as bones grow stronger and thicker themselves, because they need to adapt to meet the demand from the muscle. The levels of calcium stored in them also increases so that the bone remains hard and solid, which gives the skeleton its upright structure. However, after the age of 30, bones begin to deteriorate, and as you become older, bones become weaker because little strain is placed on the bone from muscular contractions. This means that the bone may lose some calcium stores, which causes it to become weaker and thinner. An example of this is linked to the height of the older generation. Typically, older people are smaller, which is linked to their muscles becoming thin and worn. Over time, the discs in between the vertebrae of the spine become hard and brittle. This causes vertebrae to become more likely to overgrow, which is what causes the spine to decrease in length, therefore causing a slightly slumped look. The loss of minerals and moisture of the vertebrae makes them also become thin, which means that there is a higher risk of spinal injury for an older person because the disc and vertebrae cannot absorb any impact. Furthermore, as older people do not take part in regular physical activity, it means that they cannot increase the density of their bone again as quickly as someone younger may be able to. A reason for this is because of the types of activity that older people are limited to. For example, you typically see the older generation taking part in swimming classes because the weight of the water supports the activity that they are doing. However, this is not always an advantage to them because there is a limit on this helping increase their bone density, as this normally is strengthened through weight-bearing activities. Therefore, they should work on going for a walk or some other weight-bearing activities, as this means they are adding weight on their bones but with only a small amount of impact. Another reason how age affects the skeleton is that different parts of bone will be affected. Spongy bone, also known as cancellous bone, is formed by osteoblasts that are small one-nuclei cells that synthesize the formation of bone. As you age, the amount of osteoblasts in the body decrease, which means that bone cannot be formed or replaced as quickly as someone who is younger. The cancellous part of the bone is what adds the structure to it, which is why with a low amount of osteoblasts we can see a stability of bones and joints decreasing, causing greater concern for injury for older people. This means that older people should not take part in high-impact sports because as bone density decreases, it is more likely that they should suffer from a condition called osteoarthritis. This is where bones are thin and weak, so it's easier to break a bone when simple events occur, such as tripping over. To help lower the risk of this happening, the older generation should continue to do physical activity, but they should do something of low demand, such as walking or cycling, because alongside this, helping to improve bone mass and bone density, it will also help to improve the strength of the muscles, ligaments and tendons attached to the bone, which adds support, which can possibly help lower the risk of bones being dislocated or broken if an incident was to occur. Furthermore, another factor to impact the skeletal system through aging is the amount of synovial fluid. Synovial fluid is found in the cavities of joints to reduce friction of bones on cartilage as they move over each other. According to Physiopedia.com, it is an egg-like consistency due to hyaluronic acid molecules, which are what gives it its viscosity. However, as you age, the size of the hyaluronic acid molecules decrease, which makes the viscosity of the synovial fluid become thicker and less lubricating. This means that as a joint moves, for example when bending the knee, it is a lot harder to do so as the joint is stiffer. Furthermore, when the size of the molecules decrease with age, it also leaves less synovial fluid to protect the cartilage in the joint. This means that when taking part in activities such as walking, older people have a disadvantage as cartilage can rub on the bone, causing the cartilage to wear away, which leaves the bone exposed to friction and also leaves it exposed to impact as there is no cushioning around it. The reduced amount of synovial fluid can risk older people developing osteoarthritis because without the fluid there, the cartilage disappears, causing bone to erode bone. This in itself causes pain and swelling, which can cause individuals to be less likely to take part in any activity, which may help to improve this, causing them to go on to lead a possible sedentary lifestyle, because they are unable to take part in any physical activity without pain.